Hi again, everyone. Carla Macias here, and welcome back for another edition of Best Docs Network featuring Forest Park Medical Center. We're the show that's bringing you some of the best doctors in the entire San Antonio area who are really changing people's lives. Up first in our show, we're going to hear from family physician Dr. Solomon Paley and how he helped diagnose his patient, which ended up saving his life. Let's take a look.
I had had problems with kidneys before, and I had passed kidney stones. And when I was going through my pain and all that, I thought that's all it was. And it got worse and worse. I started getting a fever, then I started throwing up, and that's when I knew it was more than a kidney stone. In my previous episodes with the kidney stones, I had not experienced that. As it turned out, when I saw Dr. Paley, he looked at me and said, "You're going to the hospital."
This patient had been established with me for quite a while. He came in for a visit one day, and he was quite ill. He had evidence of kidney failure, and his blood pressure was dropping. We put Raul in the hospital and obtained the appropriate consultations, and he was indeed in renal failure. He was very close to death. The specialist didn't give him a good chance of making it through. We did everything we could aggressively, and fortunately enough, he turned around and he's living a very active life today.
I feel great. I was not given a very good chance when I first walked in there when Dr. Paley saw me, but I made it through. My daughter was going to be getting married, and I just fought like heck to make it, to survive. I got better, and I made it, and I'm here today.
Kidney disease, including renal failure, is seen in patients who have uncontrolled hypertension, uncontrolled diabetes, uncontrolled cholesterol, and over a long period of time, these take their toll on the kidney, and slowly but surely you see the kidneys start to fail, and we're able to detect that through lab tests. In early renal failure, the patient won't feel any difference. That's why it's important for the patient to come in for routine examination and lab testing so that we can screen for things like renal failure, catch them early, treat them, and have patients have a nice turnaround.
From the time I do remember, the 14th, 15th day, Dr. Paley was there daily. And I appreciate that a lot, because he would go see me no matter what he was doing. Dr. Paley's guidance, I've managed to change my lifestyle, change my eating habits, change what I do. So now my quality of life is 10 times better.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. Laughing not only eases stress, it promotes social bonding and lowers blood pressure. It may also boost your immune system, so bring some humor into your life.
member. It's the Disney of healthcare.
Did you know that Forest Park Medical Center has an outstanding number of involvements in several community projects, whether they're here locally or around the world? Up next, we're going to hear from General Surgeon Dr. Kathy Grove and how she took a trip to Honduras that changed her life.
The church that we happen to go to has a relationship with a girls' orphanage in a small town in Honduras. The orphanage is run under an American lady. The name of the project is called Project Talitha Cumi. And it's basically a girls' home where they house 30 girls who were either abandoned or abused or orphaned. They were having some problems getting vaccinations for the girls in the girls' home. And so we received a phone call asking us to come down and assist in vaccinating the girls at the girls' home. We had to go through a lot of different and interesting challenges in order to be able to go down there. First of all, we had to get permission to practice medicine in a place that had never had an outside doctor come to it. We were able to overcome that challenge. And then the next challenge was actually receiving the immunizations that we could provide to the children. We asked several different pharmaceutical companies. We requested assistance from many of the hospitals that we work with, and we came up initially empty. We then came to Forest Park and asked them if they would be able to help us get the vaccinations to take to this small girls' home in Honduras. And thankfully, Forest Park came through. They gave us, free of charge, the vaccinations to cover every one of the girls that lived in the girls' home. The older teenage girls from the home actually came to the clinic and helped work. They functioned as medical assistants for us as well as translators. And so they were helping clean the rooms, they were helping prepare the vaccines. It was really a great experience to watch the local people work to serve their neighbors. And because they were working in our clinic, they weren't able to do their daily chores. After the clinic, we actually went back to the girls' home and helped them perform their chores afterwards. We ate their meals with them. We said nightly prayers with them. It was an amazing experience. As a surgeon, I think we have an incredible opportunity to meet and care for people at a time of great need. For me, my whole purpose in life, my dream job, is being a surgeon. I love nothing more than being able to walk through these difficult journeys with people and help them find the happiness on the other side. And so one of the things that I love most is being able to take these little short-term trips to patients and people who have great need, because it's the whole reason why I became a surgeon, and it helps remind me how much I love this job and how much I love the people that come to me.
Plastic surgery is the process of reconstructing or repairing parts of the body, especially by the transfer of tissue, either in the treatment of injury or for cosmetic reasons. Dr. Michael Baumholtz is a plastic and reconstructive surgeon here in the San Antonio area. Now let's meet the doctor.
I'm a plastic and reconstructive surgeon with additional specialty training in hand and microsurgery. I have a broad-based practice encompassing both adults and children, cosmetic surgery, reconstructive surgery, and hand surgery. I talk to and treat patients like I want someone to talk to and treat my family. And it's age and process specific. So the young woman that's considering a breast augmentation, or the young child that's been injured, or the older woman that would like a facelift, these are the kinds of people that I try to relate to as my own family members. I try to be as honest and straightforward as I know how. I talk to people not in medicalese, but straightforward, easy to understand ways. And I think that helps me connect more quickly and more deeply with the patients I look after.
Common question I get all the time is, how much sleep do I need? And the answer is, it varies. It depends on the health of the patient. It depends also on the sleep efficiency of the patient. So for example, patients who have sleep apnea sometimes will have a sleep efficiency of 30 to 40%, meaning that they can sleep up to 12 hours, but their sleep efficiency is 30% of that. Newborns, for example, need 16 hours. Preteens need between 10 and 11 hours. And teenagers need about 9 hours. If you're an adult, you need between 6 and 8 hours of sleep. Pregnancy may also increase your need for sleep, as you may feel tired most of the time if you don't take naps during the day. But the reality is that with our busy lives and with our kids' extracurricular activities, most of us don't get the sleep that we need. And what happens then? We have what we call a sleep debt. That sleep debt eventually has to be paid. Lack of sleep sometimes will lead to difficulty concentrating and focusing, and also can lead to difficulty learning new tasks. Lack of sleep also will lead to car accidents. Remember that drowsiness is the last step before somebody falls asleep. Lack of sleep will also lead to the release of hunger hormones, making the patients more hungry, and if they stay up late, of course they're gonna eat. So what happens then as you gain weight is you increase the risk of diabetes, heart disease, and stroke. Lack of sleep can also increase your perception for pain, and it can also decrease your immune system. So what happens then, you're more prone to get viral infections like colds. If you find yourself feeling very tired, even if you've had enough sleep, then make sure you talk to your doctor about performing a sleep study. This may help you detect some problems like sleep apnea or restless leg syndrome that may keep you up during the night. So don't waste time tonight. Make sure you go to bed early and start paying your sleep debt.
If you're looking for more information on any of the doctors you've seen so far on our show today, head to our website, bestdocsnetwork.com. You can do this by clicking on San Antonio under the Our Doctors tab. Once on the San Antonio page, you could browse through all the different doctors from all different specialties. Now, one of those doctors you can find on our website is pain management specialist, Dr. J. Ellis.
I was a post-cancer patient, and I was left with some very severe neuropathy of both my hands and my feet. I've been treating it for quite some time using some difficult painkillers and opiates. I wanted to do something else to get away from all the heavy medication because it had a lot of side effects. I'd always be either sleepy or I couldn't sleep, and I was having a very difficult time walking. I would fall, I would trip. I had to seek some alternate solution to my problem because conventional medicine really wasn't solving it.
One of the unfortunate aspects of chemotherapy is that while it's toxic to the tumor, it can be also toxic to other tissues in the body. Colonel Pinkson developed a rare complication where he developed neuropathic pain. The chemotherapy killed his tumor but also damaged his nerves. And he had severe pain in both his hands and feet that was poorly controlled by pain relievers. His quality of life was poor.
After examining me and hearing the history of my problems, he said, "It seems that you're going to be kind of stuck with your neuropathy problem. However, there is this new technology that seems to be providing some very promising results."
We were able to put a spinal cord stimulator in. We pass small wires or leads into the spinal canal and deliver electricity to these nerves. So now he has pain relief without all the side effects of his medication. His ability to get out, function, enjoy life is everything he hoped it would be.
I have a little remote that you could use to increase or decrease the settings in your stimulator. I just used one of them because I figured once I got one that worked, I'm going to stick with that. It's working, that's fine. I trusted Dr. Ellis, and here I am today, dancing again.
With pain medicine, we don't get to help everybody in the way they would like. But there are times where if we keep plugging away, if we make sure that our patients have access to the newest technology, the newest treatments, we can sometimes find a way to give them their life back. It goes without saying that people who get a second chance at life enjoy it so much more.
I really like it here at Forest Park. It's fantastic. All the administration, they come down and they come talk to me. It's just a wonderful, wonderful place to work. Work is fun, and that's what you want in a job. You don't want it to feel like work, you want it to feel like fun, and that's what Forest Park does. Forest Park makes work fun for me. It's not just about the job, it's about the people, and the people here are great. You can have the best job ever with the best benefits, but if you don't like who you're working with, then you're not gonna enjoy work. But Forest Park has fantastic people working here, and seriously, I love coming to work at Forest Park. It's a great place to work.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
At Forest Park, we call it the 6 senses of Forest Park, and you have your conventional 5, and it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? Are you looking at just great architecture? Are you looking at a brighter environment, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals, to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, what type of food are you having, the taste. We don't have cafeterias, we have dining facilities. What are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. What are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. We really try to play into all of those senses for our patients. So, whether it's in the lobby or it's in the patient rooms, or the thread count on the sheets, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens, where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the 6th sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our 6th sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses, from step 1, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. You know, our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
Are you or anyone that you know looking for more information on the Mommy Makeover? Well, look no further, because up next, we're going to hear from plastic surgeon Dr. Minas Chrysopoulo and one of his patients discuss the Mommy Makeover.
Well, I wanted to get the Mommy Makeover when I was 16. Before I was a mother, because I had a large stomach and it was just very uncomfortable to me, and so my mom always told me, just wait until you have kids and then you get the Mommy Makeover. So I had my 2 kids, and about 3 years ago is when I decided to start doing the consults and looking into doing the procedure. I thought about Dr. Chrysopoulo. He is a good friend of ours and he's been recommended by many wonderful people. I ended up getting on the phone with him and we talked about things. I thought he only did breast reconstruction with, cancer patients. He informed me that he does the Mommy Makeover as well. We went ahead and made an appointment and got in to do a consult.
A Mommy Makeover can include several things. We see many patients that have had kids and now are dealing with some of the changes that have come. The breasts will change after breastfeeding or after pregnancy. You don't even have to breastfeed to have changes. There's also the change in the tummy area, obviously, because of stretching of the pregnancy. Women that are considering having more kids should really hold off on having a Mommy Makeover until their family is complete. If you have surgery like a breast lift or a tummy tuck and then have more children, then much of the work will be undone.
I love the results. He went very conservatively on the breast augmentation. He didn't want him to look fake or anything like that. The tummy tuck is awesome. I've never had a flat tummy before in my life. I have a lot more confidence now. I think that I fit in clothes a lot better. Within 6 months, I was definitely in swimsuits. I would recommend it to anybody. It's been such a good thing. Dr. Chrysopoulo and his staff are amazing. They are always there to help out. They always answer the phones. It's been a great experience with them.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, are combined inside in what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
Chloe has a question for Dr. Oscar Ochoa. What makes you the ideal type of surgeon for a breast augmentation?
In our practice, we see a lot of patients that undergo breast reconstruction for breast cancer. These patients have a very complicated type of problem that requires very specific and well-trained analysis of what is going on in order to perform a good, cosmetically pleasing breast reconstruction. Those same types of skills that are used to analyze the patient for breast reconstruction are also the same types of skills that are utilized for specific analysis of a patient that comes in for breast augmentation for cosmetic purposes. Therefore, we have a keen eye in order to determine what exactly the patient needs so they can achieve their goals.
If you didn't find the right doctor on today's show, no worries, because you can head to our website, bestdocsnetwork.com, and browse through all the different specialties a part of our network. If you got any questions or comments or want to tell us a great story of your doctor, send us an email at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.